Hi guys, it's your favorite nurse educator, NP Clark, and I'm back with another cup of the morning coffee. Now, although today's cup, guys, is about potato soup, I just wanted to put that out there because it's been raining and dreary for the last couple of days, a little cooler here in Chicago, and I love potato soup, and that's what I'm making today. So, let's get started. In today's cup, guys, we're going to talk about POLST forms. Physician or provider ordering life-sustaining treatments. So this is a mobile form that has orders on it for you as the patient, your loved one as the patient, or someone that you are in charge of their medical care. And this form is to really honor the person's wishes about how they want their care to go. So most people, you'll hear them say, do they have a DNR form? Well, they got away from that because the form was the same whether you wanted them to not be resuscitated, DNR, do not resuscitate, or if they wanted to be a full code, it was still the same form. So changing the name really gives, and I guess I shouldn't say they changed the name, but this is an actual nationally accepted form now that they have created. I think back in 2019 is when I first started seeing these. Now, mine is white because I did not have the accepted pink paper. However, most of them are pink, like a deep fuchsia pink almost. And they've got, there's like 3 pages to it, but it's usually a front and a back page, and that's the actual form. And then the first page is more so giving you just some information and things like that on, you know, how to fill it out and things of that sort. So let's get started. So I'm going to actually be looking off of the form just to kind of tell you. So it says right up at the top, having a POLST form is always voluntary. So no one can tell you got to sign this, you got to do this. You know, it's up to you. However, as a provider myself and having many years in the healthcare industry, I really would encourage anybody to even encourage themselves, their loved ones, neighbors, whatever, to document your wishes. How do you want your care to go? This is very individualized. It's your choice, right? So, and that's, if you know me personally, then you know that is, I'm always the patient advocate and about what they want. And sometimes that's hard for us as families to have a loved one say that they don't want to do more extensive or aggressive treatments. And it's more so the grieving process that we all go through and just not wanting to face what they want. However, I think that we all would want to have that autonomy in deciding what happens to us, right? So, okay, this is a medical order, not an advance directive, that's why I said it didn't replace that advance directive. So this is an addition to, but it's similar information. The information about POLST and to understand this document, and they give the POLST.org website, which is where I got this form from. Now, up at the top, they want you to do the patient's name and information. So let's get down to the sections A, B, and C. So the A section is Cardiopulmonary Resuscitation Order. It says, follow these orders if the patient has no pulse and is not breathing. So for me, reading is fundamental, guys. We have to make sure that we're reading these because we know that that's not always the case. Sometimes patients are still breathing, but have a thready to no pulse. So you have to make sure that you have an understanding of what they're telling you. They said, follow these orders if patient has no pulse and is not breathing. So number 1, you check the box for yes if you want CPR. So CPR, you know, would help to sustain life. It's going to you're going to attempt to resuscitate this person. So, which means they don't have a pulse and they're not breathing. So if they don't have a pulse and they're not breathing, do you want someone to do CPR on you? That's breathing for you, use an external defibrillator. That's that little thing that you see on ER where they shock the people, right? So you may have that. Or just the regular chest compressions that we do. So requires choosing full treatments in section B, which we'll get to in just a second. So then, or you can choose No CPR. Do not attempt to resuscitate me. I don't want you to do any of those things. So in the event that I stop breathing and I do not have a pulse, leave me be. And that is my wish. Now, B, initial treatment orders. Follow these orders if patient has a pulse and or is breathing. So you see how they threw the and or in. So this is not something that you just want to go grab and look really quickly. You need to understand what they are saying in each section. Now it says reassess and discuss interventions with patient and or representative regularly to ensure treatments are meeting patient's care goals. Consider a time trial of interventions based on goals and specific outcomes. So in section B, you get to pick one. So this is kind of like a la carte. So you get full treatments. But remember, we heard if you're going to do CPR, if you choose yes to CPR, and that's any type of resuscitation, they said that they require you to choose full treatments in section B. Full treatments is the goal is attempt to sustain life by all medically effective means. Provide appropriate medical and surgical treatments as indicated to attempt to prolong life, including intensive care. So in that situation, you may end up on a ventilator. And I know that some people, they're afraid of that because everyone says, well, once you get on a ventilator, you can never get off. That's not entirely true. I've seen plenty of patients that are on ventilators and they get weaned off and eventually even have the tracheostomy removed and go on to, live perfectly fine lives, based on what's actually going on with them. So let me say it that way. That doesn't mean that, they're not going to have any other issues because it depends on really what caused them to get to that point. So B2, I guess, second choice, selective treatments. The goal here is to attempt to restore function while avoiding intensive care and resuscitation efforts, ventilator, defibrillation, and cardioversion. And I had someone ask me a couple of weeks ago, what does cardioversion mean? Just means either shock or medications that will help to return your heart rhythm to normal, right? So you obviously have an abnormal heart rhythm. So it's one of the treatments that they can do. May use non-invasive, positive airway pressure, antibiotics, and IV fluids as indicated. Avoid intensive care. Transfer to hospital if treatment needs cannot be met in the current location. So long-term care, assisted living, or at your home. And then the third of the choices here, comfort-focused treatments. The goal here is to maximize comfort through symptom management. Allow natural death. Use oxygen, suction, and manual treatment of airway obstruction as needed for comfort. Because air hunger is not something, guys, that you want your patients or your loved ones or yourself to experience. That air hunger, that impending doom feeling. That's to me, I don't want to feel like as I'm slipping away and making my transition, that I want that to be the last thing that I worry about is, oh my gosh, I can't breathe. So avoid treatments listed in full or selected treatments unless consistent with comfort goal. Transfer to hospital only if comfort cannot be achieved in current setting. So you're still going to give people, pain medications, things like that. That's why a lot of times you'll see people on hospice with like a morphine or like more so like those stomach cancers and things like that. They're probably going to go more with the Dilaudid because it's more effective with those types of cancers, right? So now we move on to the next section, C, additional orders or instructions. These orders are in addition to those above. For example, blood products, dialysis, EMS protocols may limit emergency responder ability to act on orders in this section. So if you are not an EMS, you don't really have to worry about that. But just know that if it's your loved one that EMS are working on, and they may tell you we have a protocol that we can't do that or we can do this. I know it's going to be a hectic time for you, but the yelling and screaming doesn't help them to be able to do anything better for your loved one. Give them a chance to do what they're trained to do, okay? All right, section D, medically assisted nutrition. Offer food by mouth if desired by patient. and if it's safe and if they can tolerate it. So you don't want to be feeding someone that they already told you has an issue with swallowing. So if they or if they start vomiting, you know, generally if something's in there and it needs to come out, that's why we vomit. So let it come out. Don't keep trying to feed them, right? But then that's where the medications from the other sections can come in. Something like a Zofran or something to kind of help with that nausea and vomiting. So in this section, you're going to pick one, and there's 4 choices. Provide feeding through new or existing surgically placed tubes. A trial period for artificial nutrition, but not surgically placed tubes. C, I guess, would be no artificial means of nutrition is desired. And lastly, not discussed or no decision made, provide the standard of care, which we know is if they are thirsty, we want to, even if we want to just get a little mouth swab, you know, and have them to get at least a little bit of hydration in, right? Okay, so then the final 2 sections here are the signature of the patient or the patient's representative, and the new POLST form says that they accept e-signed documents. And e-signed document is they actually have different platforms for legal e-signatures, and not just something, because it comes up with like a date, time stamp and things like that. So it's not just something where I can go in and take a pen and write on my tablet to sign, as far as my understanding. But maybe one of our lawyer friends can help us to understand that. So, and here, I know I normally give a shout out to somebody, so I'm going to go with Lisa Mack now. She is an attorney and a friend. So maybe we will get her on the line at some point to help us understand these, what she does in her practice. So, again, the patient or a patient representative. Now, patient representative is not just somebody that walks in and says, I went to middle school with this person 20 years ago, and I haven't seen them since, but I believe I know their wishes. So they usually appoint a person, and that's why you want to do this as early as possible for the patient, so that way you don't run into those problems. Because what you'll see in doing these, you're going to have a lot of family discord. They're going to be upset. One person will say, no, this is what mom's wish was. Next person will say, no, this was not. I never heard her say that. I don't believe that. So if we are proactive about filling out these forms, we will know what the patient wants while the patient is still able to make those decisions. So power of attorneys, surrogate decision makers, state guardians, or just husband, wives, parents, et cetera, et cetera. Okay, then the final signature that has to be on this form, guys, is the healthcare provider signature. Now, this new form, we, I guess as providers, we have to put our license number and licensure or certification. So whatever board is certifying you to practice MP, PA, or MD, and so on and so forth. So in order for this form to be legal, both of these signatures must be present. Does not matter if the provider signs if there's no patient or patient representative. And for me, I ensure that my signature comes after the patient and their representative. So I know what I'm signing, what I'm verifying that this is true and accurate information. And I do not sign these guys, and many of you know this, I refuse to sign them without actually speaking with the patient or their representative myself, just because I want to make sure that I am providing the best care possible and honoring the wishes of my patient. Okay? So this was the POLST form. DNR, advanced directives, all of those forms, they have their own name because they're a bit different. However, POLST form is a medical order. It's like a mobile order to get your wishes out there to your friends, family, and others. Okay? So guys, this has been NP Clark, your favorite nurse educator, with another cup of the morning coffee. Thanks, guys. Make sure you share, like, and subscribe.